gentlemen, as we move forward in the prestigious evening, it is now time to welcome the eminent dignitaries, distinguished guests, industry leaders, healthcare visionaries, architects, policy makers and change makers who have gracefully inaugurated the celebration with their esteemed presence. Please join me in welcoming all the dignitaries of today. Time now for panel discussion 4, Healthcare Infrastructure Meets Urban Planning, Building Health Cities Not Hospitals. May I request our esteemed panelists to join us on the stage. The moderator of this panel will be Dr. Vinod Singh, founder and consultant, Hospitech Healthcare Consultancy Private Limited. Give him a big round of applause, everyone, as he's joining us on the stage. Richa Singh Debgupta, Group Chief Strategy Officer, Fortis Healthcare. Major General Dr. Jakhtar Singh, VSM, Executive Director, AHA. Give him a big round of applause, everyone. Nivedita Dilip, Associate Councillor, CII, Indian Green Building Council. May I request Richa ma'am to take over?
Hi, good afternoon, everyone. Now, our topic is healthcare infrastructure meets urban planning. Now, I'll start with my questions. And my first question will be to Dr. Rajiv. So, Dr. Rajiv can start with One Health.
Thank you, Dr. Vinod. And thanks the organizers for inviting me to the HPIE 5.0. The concept of One Health, I think COVID-19 pandemic has shown what One Health is all about. If you are challenging that at one particular aspect, I would say that understanding of the concept of One Health. The moment you understand, your thought process changes so much that you stop thinking in silos. You stop thinking in aspects which are very insignificant in genesis of a disease or the system, and then you start finding solutions so easy that the impact is much more, investment is very little, and growth, so-called growth in more than financial terms, I would say, because it becomes sustainable. I think that would be the single most important factor I would consider.
Thank you. I'll move to Ms. Richa now. Ms. Richa, you come from a corporate hospital group. My question to you would be from the investor point of view, that is prevention ever going to be a serious business, or is investor interest always win at the end of the day?
See, I think nobody is disagreeing with the fact that prevention is always better than cure, right? And as healthcare professional, we know it very well. In terms of the perceptive value that hospitals are purely meant for curative, I think it's wrong. Okay? Now let's start from any hospital's function. If you look at it, preventive health checkup has been existing in the setup for long years. It has been 20-25 years that each of the hospital would have preventive health check. So preventive health checkup, last year we had taken that we would be growing the footfalls in preventive health check by 12%, and actually we have ended up achieving 15%. That goes on to say that there are people who want to get that check, they want to kind of keep themselves healthy, and hospitals are welcoming that step. Is what I would like to add.
Thank you. Dr. Jakhtar, the next question is to you. When we say health city, what are the core requirements of a health city to be truly classified as a health city? Is it the infrastructure, or is it the governance, or is it the community system? How would you rate a city to be called a health city? And please introduce yourself and your organization also.
Okay. Good evening, everyone. I'm General Jakhtar Singh. I first of all thank Medgate for this invitation. I am from the Armed Forces Medical Services. I have retired after a service of nearly 40 years, and presently I am the Executive Director of the professional body of hospital administrators in the country, which is AHA, that is the Academy of Hospital Administration. So what are we doing? We are actually have, in a certain way, isolated care into certain hospitals, right? Big, small, medium, whatever it is. But when we talk of health cities, we are trying to take out this care from these hospitals and embed it into the journal life of the inhabitants of that place. That is what is happening. So I would, sum it up by saying that this is a concept that we need to now sort of look at if we really want to move away from only treating sickness to getting into the realm of wellness. Thank you.
Thank you. Ms. Nivedita, the next question is to you. You come from the Green Building Council. For a layman, why is there so much of talk about green building? And what are the things that we still make a mistake in terms of the operational or the infrastructure guidelines that we follow when it comes to green building? Just the simple mistakes that we still make. Although there are a lot of buildings that still come up with green buildings, but not too many of them. They're a very handful of numbers. So why is it that it's not taken up to a larger extent in terms of catching up in bigger cities and other tier 2 towns also?
So I'll start off by giving a broader perspective. If you see the building and the construction sector, it is one of the major contributors to the global warming. So the building operations contribute to nearly 28% of the greenhouse gas emissions, and the building materials and the construction activities, they contribute to nearly 11% of the greenhouse gas emissions. So overall, nearly 40% of the greenhouse gas emissions is from the building sector. And within this, if you see, the healthcare sector contributes to around 4% of the global greenhouse gas emissions. We have IGBC is the only council in India which is having a dedicated framework for green healthcare facilities. It's not a generic one for all commercial buildings.
Well, thank you very much, everyone. And at the end of this session, I would like to thank the organizer, HPIE Medgate today, and all the audience for being with us till the end. Thank you.
Such an insightful session. May I now request Vivek Desai sir to facilitate all the panelists. Please welcome him to the stage with a big round of applause, everyone. Give them a big round of applause, everyone.